Well, federal health officials are quickly ramping up testing ability and today announced the first U.S. drug shortage tied to the viral outbreak that's disrupting production in China. But they declined to identify the manufacturer or the product.
Health reporter Stephanie Stahl is here now with the latest.
That's right, guys. Well, first of all, we have no new cases reported in the United States today. We are still at 60, but more widespread testing is now underway. And the investigation continues in California, where the first community transmission happened. It is unclear how that patient was infected. The person with an unknown origin of coronavirus remains hospitalized in Sacramento, and now officials are starting to quarantine people who may have had contact with her.
This is a random individual in a community of 450,000 people.
Health officials say the patient first went to a hospital in Vaca Valley. When her symptoms worsened, she was brought to UC Davis Medical Center. It was days before she was diagnosed with coronavirus.
Which means that there were multiple healthcare personnel who were exposed to the individual. Some of them are under isolation. Some of them will be under quarantine.
Both hospitals are near the Travis Air Force Base, where hundreds of Americans returning from China and Japan were quarantined. But officials found no connection between the woman and anyone at the base. Her diagnosis was delayed because of testing restrictions. Now the federal government is working to increase testing capabilities. Nationwide, at least 40 labs are able to screen for coronavirus. That number is set to more than double to 93. The New Jersey Department of Health says it now has the ability to screen coronavirus in its West Trenton lab.
The virus poses the most significant threat to people with weakened immune systems, like seniors or pregnant women who may be at higher risk of developing pneumonia or other complications.
And most cases of coronavirus are mild. Symptoms are flu-like, but health officials say having had a flu shot will not guard against getting coronavirus. And we continue to have no reports of any cases in our area in Philadelphia.
Yeah, but we're preparing.
We are prepared,
Indeed.
absolutely.
And here's an example of that. Coronavirus fears have sparked a mad dash for cleaning products. Retailers like CVS and Walgreens say they've noticed an increase in demand for hand sanitizer, cleaning wipes, and face masks. The demand is so great, officials at CVS are worried there will be a shortage. Bath & Body Works says it's also seeing a spike in demand for hand sanitizer. And still ahead, coronavirus travel concerns. The virus has some thinking again about their plans to head out of town. We'll tell you what you should do if you have a trip planned. Our Shantae Lance will join us with that story at 5:30.